Hey, Adam Cooper here with Senior Healthcare Insurance, and in this video I want to talk to you about a question that I get quite often. And whenever I get this, I pretty much immediately stop them and say, okay, listen, I understand what you're trying to find out, but you're actually asking me the wrong question. And whenever I say that to someone, they kind of get put back and say, what do you mean, Adam? What do you mean I'm asking you the wrong question? And the question that I get is, hey, Adam, does my Medicare supplement pay for, and then fill in the blank, put it, for whatever procedure, right? Does my Medicare supplement pay for this, or does my Medicare supplement pay for that? And for the most part, it's yes, it covers it. But then I say, yes, but you're asking me the wrong question. And whenever I tell them that, they, what are you talking about, Adam? What do you mean I'm asking the wrong question? The question that you should be asking is, does Medicare cover that particular procedure that you're asking about? Because as long as Medicare pays for it, as long as Medicare covers it, your supplement automatically will cover it as well. Because that Medicare supplement plan, the only thing that they're looking at is whether or not Medicare paid on that claim. So as long as Medicare paid, that supplement's going to. Medicare supplement plans, all they do is follow Medicare around like a little puppy dog on a leash, right? Anywhere Medicare goes, that supplement follows behind, and all they look at is, does Medicare pay on that procedure? As long as Medicare paid on it, they're going to also. Now, the difference is going to come in on which particular plan that you actually have. So for instance, the three most popular plans right now are Plan F, Plan G, and Plan N. Now, Plan F pays the deductibles and co-payments, co-insurance, and everything like that. It's very, very simple, but it is the most expensive way to have a Medicare supplement plan in most states. So if you have a Plan F or even a Plan J, which happens to be an old plan that works very similar to Plan F, you're probably paying way more than you should for a plan that there's other options that actually are a greater value. So if you have a Plan F, call me and let's talk about it, see if we can lower your premium. But Plan F pays that deductible. Plan G has a one-time annual deductible, and once that's met, then it doesn't cost anything else extra. It pays 100%. As long as Medicare pays first. Plan N still has that same small deductible. And it's actually not a deductible from the plan. It just doesn't pay the Medicare Part B deductible, which is very small. It's once a year. But anyway, once that Medicare Part B deductible has been met, Plan N has the way it works is you pay a 20% coinsurance up to a maximum of $20 whenever you go to the doctor. And it's a 20% coinsurance for a maximum up to $50 at the ER. And the only other little difference is really not a big deal, is the fact that it does not pay what they call the Medicare Part B excess charges. So what that means, and now Plan F and Plan G, they both pay for that, but what that means is if you were to go to a provider that takes Medicare but is not contracted with Medicare, they're allowed to charge up to 15% above the Medicare allowed rate, and they bill you for that. Now, as long as you go to a provider that is contracted with Medicare, then it's not anything that you actually have to worry about, because part of the contract says, hey, you're not allowed to do what's called balance billing, charge you that 15%. So again, as long as you go to a doctor, hospital specialist, whatever it may be, as long as they're a contracted provider with Medicare, that's not even an issue. But again, those are the three most popular plans. Now, what I want to make sure that I'm clear about here is as long as Medicare pays first, that supplement pays second, leaving some or very little or anything at all behind left for you to pay. So again, if you have one of these supplement plans and you feel like you're maybe paying too much and you'd like to have somebody do a real quick review with you, I just want to invite you to give me a call. My number here is 870-215-3136. You can call or text that number, and let's have a conversation, and let's see if there's any way I can possibly lower your rate. So like for instance, I had a lady call me up one day, and she's with a company that she was paying on a Plan F over $210 a month. And I was able to put her on a Plan G, and the only difference between Plan F and Plan G is she is now responsible to pay for that one-time annual Medicare Part B deductible. But even with paying that Medicare Part B deductible out of her pocket, the amount of premium that I saved her is over $900 a year, and that's including her paying that Medicare Part B deductible out of her pocket. Now, can I promise you that that's significant in savings? No. But if it's $200, $300, $400, $500 a year, that's how much money you can actually put back in your pocket, keep it where it belongs, as opposed to sending it off to an insurance company. So that's what I want to invite you to do, is give me a call if you've got a Medicare Supplement Plan and you'd like to see do a rate review and see if you qualify for a rate reduction. Again, my name's Adam Cooper with Senior Healthcare Insurance. I appreciate your time. Look forward to speaking with you, and I'll see you in another video. Bye for now.